Hello, my name is Chastity Cravens. I'm a student at Sullivan University College of Pharmacy, and today I'm going to review a patient with you. Our patient is RR. She came in with the chief complaint of I feel bad. She's a 2-year-old African-American female. Some other information: she was referred to us from a pediatric oncologist for febrile neutropenia. Her mother said that she did seem warm to the touch this morning and has been lethargic all day. Our patient received day 1 of induction on 4/15/21. She was diagnosed with acute lymphoblastic leukemia 1 month ago and is actively receiving chemotherapy. Her family history is non-pertinent. In her social history, she lives with a dog and 6 chickens. Our patient has no known drug allergies, and her medication she is currently taking is Bactrim 200 by 40 milligrams per 5 ml by mouth 2 times a day on Saturday and Sunday. Chlorhexidine 0.12% oral solution, swish 15 milliliters by mouth 3 times a day. Ondansetron 4 milligrams per 5 milliliters oral solution, give 2 milliliters by mouth every 8 hours or as needed. Dexamethasone 2 milligrams by mouth 2 times a day. Famotidine 10 milligrams by mouth 2 times a day. And she's also taking a vitamin D and a calcium supplement, 1 tablet by mouth daily. All of her immunizations are up to date. When reviewing the systems, our patient had a fever. In physical findings, there was redness around her port site. Some of her vitals: her blood pressure is 110/58 millimeters per mercury. Her heart rate is 118 beats per minute. Her temperature is 39.4 degrees Celsius. Her respirations per minute is 25. Her height is 73.7 centimeters. Her weight is 10.5 kilograms, and her BMI is 19.3 meters squared. When looking over her labs, all of these labs below are low. Her hemoglobin, her hematocrit, her MCV, her white blood cells, her segmented neutrophils, and her banded forms are all low. Her BSA is 0.46 meters squared. Her serum creatinine is 0.54 milligrams per deciliter, and her creatinine clearance is 56.4 milliliters per minute. Her diagnostic testing that we did: her fever is over the 38.3 with a temperature of being 39.4 degrees Celsius, and her ANC is 90 cells per microliter. And the cultures of central, peripheral, and urine are all pending. Her problem stated is febrile neutropenia, with the evidence of being a fever of 39.4 degrees Celsius and an ANC of 90 cells per microliter. In addition, there's redness around her port, leading us to think there's a catheter infection or skin and soft tissues, meaning our patient is high risk. I used the IDSA clinical practice guidelines for the use of microbial agents in neutropenic patients with cancer, 2010, updated by Infectious Diseases Society of America. The plan for this patient, the goals that we want are returning their temperature back to normal by initiating medications within 60 minutes, increasing her ANC to over 500 cells per microliter, and returning the port site back to normal physically. My suggestion is to use cefepime 525 milligrams IV every 8 hours and vancomycin 160 milligrams IV every 8 hours. And for the duration of each of these, we want to continue these medications until the patient is afebrile for 24 hours. We get negative blood cultures at 48 hours or for 48 hours, and an ANC is returning to over 500 cells per microliter. For both of the medications, for safety, we want to monitor her serum creatinine, and for vancomycin, we want to monitor red man syndrome potentially happening. And then overall, we want to monitor the patient's BP for sepsis. And then for efficacy for both of these medications, our patient becoming afebrile, the ANC increasing to over 500 cells per microliter, and the port site returning back to normal. What questions do you have for me?